Welcome back to the channel. My name is Mboi. I am a nurse. I work and live in United Kingdom. So today we are going to talk about common emergencies that you may come across in the care homes. So I am an adult nurse in United Kingdom, Wales, and I work in a care home. A care home is an institution housing elderly individuals above 65 years or roughly around 65 and above. Those are diagnosed with dementia, physical disability, Parkinson's disease. There are other types of care homes that are residential, respite, and other types of care homes that houses people with mental health issues, learning disability care homes. There are diverse care homes. So there could be emergencies where you need to act fast to save life. So what are those emergencies that you can expect? There are many emergencies that you need to deal with in a care home, but these ones are the common ones, and the nurses come across them almost every day in their daily routine. So what are you going to do when you encounter an emergency? What are the things to consider? What do you need to do in dealing with emergencies? So that's what we are going to explore today. If you think this is the kind of information that you wish to carry on listening to, please consider subscribing, liking, and sharing this video. Actually, I want everyone to understand what happens in a care home, especially when there is an emergency. Care homes are meant to be a home for individuals that are unable to fulfill activities of daily living by themselves. So this includes bathing, feeding, taking their pets to walk, doing shopping, going for checkups in the hospitals or local GPs. So basically, it's just an institution that extends the current living in their own home, but then now they are in support of health professionals, because in a care home, some of the care homes, they need a nurse 24/7, like the one that I'm working for. Without wasting more time, these are the commonest emergencies in a care home. Falls, that's number one. If anyone falls, that is an emergency, because you don't know what can happen following that fall. So let's say this person is still able to walk, and they were walking and then tripped on something and they fell on the ground. What are the things that you need to do? So there are different types of falls. It could be witnessed fall, unwitnessed fall, or assisted fall. So by assisted fall is that you are close to this person, you are alone, and this person is falling. What you are just going to do is just to guide them into the floor, bearing in mind that you need to protect yourself. You don't need to get injured, because if this person falls and you are also injured, there are two casualties. So you protect yourself for you to be able to help this person. So you guide them to the floor, and then that is the assisted fall. Following a fall, there are multiple things that you need to consider. There are many things that you need to think of before you can do anything. If it's an assisted fall, then you are quite sure that you tried to prevent injuries. But if there were injuries, then you will deal with them and you will know the extensiveness of the injury. But if it was an unwitnessed fall, or a witnessed fall but far from you, the fatality of that fall may need you to think of the type of medications the person is on. First of all, in a care home, These people are old and they are frail. They might have gone through surgeries in their early ages, or they might be suffering from osteoarthritis, or they might be taking blood thinners. So the first thing that you need to think of when a person has fallen is what type of medications are they taking. If they are on blood thinners, then you should anticipate internal bleeding. It could be underneath the skin, or it could be furthest into the tissue. So did this person hit the head? If they hit the head, you should also consider brain bleeds, contusions, concussions, and immediately think of loss of consciousness if they hit the head, confusion, and those are the things that you need to think of. And if this person fell, what caused the fall? Is it because of the mobility reduction or constraints, or there were obstructions around the person, or is it because the level of hydration was low, dehydration, or is it because this person is brewing some sort of infection that is causing some dizziness or confusion, or is it because of alcohol intake? Now, in the care home, people in the care home, this is their own home. So you are not supposed to change the routine of life. Yours is to guide them to good practices that promote good health. But if they choose to continue taking alcohol, if this person fail, you need to ask yourself, is it because he or she has just taken an alcoholic drink, or they did not? So that you know what to do next. And another thing is, was this person convulsing when they fell? Because if you have an epileptic person in a care home, you know that when an epileptic episode struck in, well, it does not tell you when now that I'm an epileptic attack. No, it just comes, and then this person will fall, convulse, and then you will deal with that later on. So was that a convulsive related fall, or if this person fell then had a convulsive episode, is this person an epileptic? All those questions you need to ask yourself before you can call emergency department. So in the UK, the emergency services is 999. You call for help from your colleagues, and then you call 999 after initial assessment has been done, and you have noted that this person, I cannot move this person because I suspect fractures or spinal injury or head injury, extensive head injury. If you then decide to move this person, you need to know, how are you going to move this person? Is this individual able to stand up on their own, or is this person unable to stand because of panic attacks, or is it because of pain? Then there are assistive devices that you can use to help this person stand up from the position on the crown. There are different devices that you can use. It could be a hoisting machine, or you can use a camel, or you can just give them their walking stick and they can stand up if they are not injured. So there are so many things that you need to take into consideration for falls. And then in the care homes, like I have been saying, that you follow the guidelines. In my previous videos, you follow guidelines. There is a fall protocol for every care home. So you will know what to do following the protocol. It will give you a step-by-step to make sure that your resident is assisted safely and is cared for accordingly. Medical emergency in the care home is stroke or heart attacks. Those ones are a bit tricky, but they happen. You need to know the signs, the imminent signs of stroke or imminent signs of heart attack. So with stroke, there is a template, if I'm correct to call it a template, but it's called FAST. So FAST is it's an abbreviation for face, arms, speech, and time. So if you look at this person, you see that the face is uneven, the mouth is drooling to one side, the other side of the face, and the eye is closed or is not reacting to any movements close to it. Then the A is for arm. You ask your person, your residents to try to hold their arms in front of them like this. If they cannot hold one arm evenly at the same level together, then you know that there is a stroke. For maybe this other arm is weak, is unable to hold it to the same at one position, you know that is weakness of the arm. And it's S for speech. If the speech is slurry, you know that is stroke. And then if any of the three is there, even if it's one sign, you need to call the ambulance for them to come collect this person. So if you call 999, you make sure that you have the age, sex, medical history, and vital signs in hand. Because this is a care home, you are a team, you are a nurse, you will delegate. The senior carer can call 999 while on hold. You do the vital signs, you do the assessments, and then when the 999 people answer, you narrate your findings. They will guide you on what to do following the call. They might tell you quick medical management that you can do at the care home until they come to see this person and take to hospital. Not only that they are going to take this person to hospital, if this person does not want to go to hospital, you have to honor their wishes. So care plans will tell you that. You will look into their care plans, or you already know that this person does not want to go to hospital, or you already know that if this person suffers from stroke, then is willing to attend hospital assessments. So yeah, that's about stroke. With heart attack, you know, there would be imminent sharp chest pains, breathlessness, sweating. Other people will not be able to stand up because of that pain, and there could also be numbness of the left hand. There are so many other signs of heart attack. Then you will also call 999 and then wait for them to direct you on what to do, and they will come and do the assessments. Then following all that, they will guide you on what to do. That's about heart attack and stroke. That is the medical emergency that you may come across in a care home. So with other people for heart attacks, if this person has had a heart attack before, you find that in their medications, they have cardiovascular medications that prevent heart attack. But if there are other medications that are taken only PRN, then you can administer those while you wait for ambulance. Another medical emergency that you might come across in a care home could be bleeding. So there could be types of bleeding that you might come across in a care home. There might be bleeding from a skin tear following a fall. Then you will know that how to manage that, because there are protocols on how to manage skin tears. And if it's complex, then you can call for 999 if it's a huge tear. But if it's something that you can manage yourself, you will follow wound care protocol in the care home, or you can involve the GP, the local general practitioner, and also you might involve tissue viability nurses. They might be able to assist you in that part. Another type of bleeding that you might come across in a care home is the bleeding from a catheter. So some of the elderly individuals that you will be caring for would have a lifetime indwelling catheter. So when someone is agitated, they don't know what is happening, they have dementia, they are dealing with forgetfulness. So they might be thinking, what is this catheter? And they will try to pull it off and then cause bleeding. There is also a protocol in a care home on how to manage bleeding from a catheter. And if it's too much bleeding, then you call 999 or you call the GPs, depending on how much the bleeding is. So as a nurse, you will assess and you will know how to act on the certain bleeding. But anything blood, you don't just sleep on it. You need to inform the local GP. If it's at night, there are out of hours GPs. If they are unreachable, there is another team that deals with advice. I can't remember what it's called in Wales. And if those guys are not picking up, then you call 999. Don't sleep on bleeding. None. Even if it's just drops of blood, report it, because you don't know where it's coming from. You don't know what is causing it. Especially if it's a catheter, it means it's internal bleeding. The ones that you are seeing outside, what if there is internal bleeding that is more profuse than the one that is visible? So you report any kind of catheter bleeding. Another bleeding that you might come across could be gastrointestinal bleed. It might be through vomiting, or it might be through pooing. You can see that by black tarry stools. They are suggestive of blood alongside the gastrointestinal tract. Or you might find fresh bleeding stained on the bowel movement contents stools, which is suggestive of rectal bleeding or anal bleeding. Then you'll be able to report it and assess, report, and then get advice on what to do. Another type of bleeding that you might come across in a care home could be epistaxis, nosebleed. Nosebleeding is just a complex one. It could be as a result of nose picking. That's number one. It could be following the intake of blood thinners. It might also be related to elevated blood pressures. So there are so many causes of epistaxis. So you just don't sleep on nasal bleed. You take vital signs, you report to local GP, and then you just assess. If it's profuse, then you call 999, because if it's not stopping, that person is going to go into shock. So you don't want that in a care home at all. You don't want anyone to be in a shock in care home. And with ambulance services, they are overwhelmed. So the earlier you report, the better. That is medical emergency number 3 that you might come across in a care home, which is bleeding. Another medical emergency could be unresponsiveness. So you get into this room, you find one of your residents thinking is asleep, you get in, good morning, he's not answering. You shake, it's not answering, unresponsive. What could be the cause? It could be TIAs, it could be hyperglycemia, hypoglycemia, it could be vasovagal episodes. So you need to know their medical history for you to anticipate what could be the cause of unresponsiveness. The other thing that is unpleasant about unresponsiveness, it could be it's an unexpected death. So you really need to act on unresponsiveness, take vital signs, report it immediately, call 999. This one is a 999 situation, because if someone is not responding, you need paramedics ASAP. So you deal with them accordingly. So there is a protocol for unresponsiveness in the care home. It will give you step by steps on what to do, what to follow, and how to manage it. Because if you don't know what caused it, then you need to explore multiple things after you called for emergency services to come and see this person. And with emergencies, after you call ambulance services, you also have to involve family members. Tell the family members of the changes of their loved ones. Another common medical emergency that you might come across is choking. So, elderly, when they grow up, when they grow up, swallowing reflexes tend to be lax, and choking episodes increase. Now, as a nurse, this is my advice: meal times, make sure that you are there so that you deal with choking. You also deal with when you are there during meal times, you will see when something is of danger, if something might cause choking. You know your residents, you know that that person is very fast when they eat, so I need to sit next to this person and encourage them to slow down. Or you know that this one will just take the whole slice of bread in the mouth, then you will have to cut it into smaller pieces to encourage them to take their time, And unfortunately, if anyone chokes, you are there, then you follow the choking protocol, first aid steps. And if that person does not dislodge that bolus, then you call 999 while you maneuver the choking. When you proceed with the choking maneuvers, So that is another common medical emergency that you might come across in a care home. Okay, guys, these are the 5 ones that I can mention that are very common, but there are more. So just know what to do in cases of emergencies. Oh, guys, I have a cold, and I think it's going to my voice now. I thank you very much for watching this video. I will see you in my next one. Please consider to subscribe, like, share, and bye. Keep commenting on the comment section, and I will see you in my next video. Bye bye.